Today I have Dr. Nikita C. Shah, MD, Medical Oncology Team Leader for the Breast Cancer Center at the Orlando Health Cancer Institute. And we're here to talk about some new data that they found. Good morning, Dr. Shah. How are you?
Good. Thank you for having me.
So, what does the risk of reoccurrence mean for patients with HR plus / HER2 EBC, whatever that means? Explain that.
So, breast cancer is classified based on whether it's hormone receptor positive or HER2 positive or negative. So, the NATALEE clinical trial was a trial with postmenopausal women with hormone receptor positive, HER2 negative breast cancer, early stage cancer where patients had definitive surgery, chemotherapy, radiation therapy, and endocrine therapy, and then were also randomized to getting a CDK4/6 inhibitor called ribociclib, which is currently approved and used in the metastatic disease setting. So we know that with early stage breast cancer, there's still a risk of the cancer coming back in spite of everything else that the patients may do. So these trials are looking and saying, what can we do to reduce that risk of the cancer coming back? And that's exactly what we saw in the NATALEE clinical trial, was a 25% reduction in the risk of recurrence with the addition of ribociclib. What we also saw was a very favorable safety profile of the drug. No new safety signals were identified. Most common expected side effects were neutropenia and liver dysfunction. And these results are still investigational, but this is very exciting news for our patients with early stage breast cancer.
Now, what are some of the current gaps EBC patients face when addressing their risk of reoccurrence?
It's this exact risk of recurrence and the fear of that recurrence and not knowing if and when they will have a recurrence. And we know that once there is a recurrence, as of today, we don't have any curative therapies. And that's why our treatments up front continue to be more aggressive, so that if we can prevent a recurrence, prevent the cancer from ever coming back, we're one step ahead.
Now, can you tell us more about the NATALEE data presented by ASCO, and why are these results significant?
So NATALEE clinical trial was a trial with over 5,000 postmenopausal women with early stage hormone receptor positive, HER2 negative breast cancer. And they got their standard upfront treatment, be it chemotherapy, radiation therapy, surgery, and along with endocrine therapy, they were randomized to either getting a CDK4/6 inhibitor like ribociclib or just endocrine therapy alone. And these results are significant because we saw a 25% reduction in the risk of recurrence with the addition of ribociclib.
Now, where can our viewers get more information?
The website is nataleetrial.com, NATALEE trial.com.
Dr. Shah, do you think we'll ever beat cancer in our lifetime?
That's the goal, and that's what trials like this are helping us do, that we can prevent recurrences, and eventually the goal is we can even prevent the development of breast cancer. We're getting there.
Wow. We're getting there. That's good. We're talking with Nikita Shah, MD, Medical Oncology Team Leader for the Breast Cancer Center at the Orlando Health Cancer Institute. Thank you so much for joining us on Morning Blend and giving us information.
Thank you for having me.